So thanks very much for having me present here today. And really today I'm presenting on behalf of the team, particularly Negabehe, who led the implementation of this study, but can't be here today. So today we're going to talk about the effectiveness of timely hepatitis B birth dose vaccination to prevent mother-to-child transmission in Ethiopia. So the background, as you're well aware, mother-to-child transmission remains the main route of new hepatitis B infections. And the coverage of hepatitis B birth dose vaccination in the region is very low. Unfortunately, there's been limited and conflicting data on the effectiveness of hepatitis B birth dose vaccination in Africa, and this conflicted from previous data from Asia and high-income settings. There was a study from ECRA from Côte d'Ivoire nearly 20 years ago, which showed that there was no statistically significant difference between the group of infants who received vaccination at birth with those who didn't. And this in part contributed to the lack of progress on hepatitis B birth dose vaccination coverage in the continent. In Ethiopia, the hepatitis B policy context is that there's a high burden of hepatitis B. The Ministry of Health implemented a pilot for hepatitis B birth dose in 2021, and with planned implementation nationally this year or next year. Pregnant women are routinely screened for hepatitis B in pregnancy, but antiviral prophylaxis at the time of the study was not current practice and birth dose wasn't available, but was available at patients' own expense. So our aim was to assess the effectiveness of timely hepatitis B birth dose vaccination in reducing mother-to-child transmission in Ethiopia, and this is part of a wider multi-country study called the Impact B study, which is also taking place in Gambia and Senegal. Here I report on the Ethiopian cohort. So the methods. This was a cross-sectional, observational, multi-center study in Ethiopia. It was a pragmatic design because it's not ethical to do an RCT comparing no birth dose and birth dose. And we leveraged the window of opportunity of the Ministry of Health birth dose pilot. Mothers who had tested positive for hepatitis B during a recent pregnancy were identified and invited for assessment of the mother-child pairs at the age of 6 to 12 months postpartum. Mother-to-child transmission was compared in those who received birth dose and those who hadn't. So the analysis, the final analysis, included 387 infants born to hepatitis B surface antigen positive mothers who were HIV negative, who had not received any antiviral treatment during pregnancy, and the infants had all completed 3 courses of EPI birth dose hepatitis B vaccination starting at 6 weeks of age. So the median maternal age was 29 years. 8.6% of mothers had a high viral load, over 200,000. And the median infant age of testing was 10 months. The interventions received, interestingly, at birth, 131 had no immunoprophylaxis at birth, 39 had received a timely hepatitis B birth dose vaccination, and actually 217 had received a timely hepatitis B birth dose vaccination plus immunoglobulin. So to be discussed, but not the main objective of our study. So here, when we look at the main results, this is the effectiveness of birth dose stratified by intervention and maternal risk profile. And here we see that without any immunoprophylaxis at birth, the transmission was really high, 15%. And with birth dose alone, this was reduced to 0%. Of course, the group is small, but this showed that mother-to-child transmission significantly reduced the, hepatitis B birth dose vaccination reduced mother-to-child transmission significantly. Then another finding is that if the mother-to-child transmission was over 90%, if the maternal viral load was over 200,000 and there was no birth dose. So consistent with data from Asia. There was no transmission in the group that received birth dose and immunoglobulin at birth. And the maternal factors associated with transmission in the no immunoprophylaxis at birth was expected, high viral load and e-antigen independently. So this was a bit of a whistle-stop, but happy to discuss any more. But our findings support the current vaccination series starting at 6 weeks of age in Ethiopia is not sufficient to eliminate hepatitis B. Timely hepatitis B birth dose is effective in Ethiopia, and the findings really support the urgent introduction and scale-up of birth dose vaccination in the region. Thank you very much.